I'm Jada. I'll be your student nurse today. Can you
Okay.
verify your name and date of birth for me?
Leah Regis, February 22nd, 1972.
Do you have any allergies that I need to be made aware of?
No,
As far as culture considerations, are there any cultural considerations that I need to be made aware of?
no,
As far as pain, are you experiencing any pain today? 0 being no pain, 10 being the worst pain?
zero.
And as far as goals of care, do you have any goals of care that you would like to meet today?
Just good health.
Good health. Okay, that's great. I'm gonna go ahead and perform a basic gastrointestinal genitourinary assessment on you. Is that okay?
Of course.
I'm just gonna ask you a couple of questions. I'm gonna palpate a couple of areas in your abdominal region, and I'm gonna listen to a few bowel sounds. Is that okay?
Yeah, that sounds great.
Okay. As far as your stool goes, about how often would you have a bowel movement?
Roughly like once a day.
Once a day? Okay, that's good. As far as consistency with your stool, have you noticed any abnormal color or any changes in your stool? Would you say it's about solid?
Yes.
Okay. Okay. Do you have any pain during urination?
No.
Do you experience any back pain?
No.
Okay, that's good. As far as vaginal discharge, are you experiencing any changes in the color, consistency, or smell of your vaginal discharge?
No.
And are you currently sexually active?
Yes.
Okay, that's fine. I'll make sure I document that, okay?
Thank you.
All right. Have you voided within the last hour?
Roughly, I think 30 minutes ago.
30 minutes ago?
Mhm.
Okay, that's good. All right, Miss Leah, could you go ahead and lie on your back for me?
Okay.
Thank you. Okay, and can you go ahead and lift up your shirt for me?
Okay.
Thank you. All right. Thank you. And can you lift up your head for me? Okay, you can put your head back down. There was no presence of bulging. If there was bulging, that could indicate a possible hernia. And if there was any bulging, like I said, I would then measure with my tape measure the girth from the umbilical region. Okay, I'm looking at the contour of her stomach and it's flat. I'm assessing the color of her abdominal area, which is that matching to her arms and her face. Okay, I'm looking at her stomach. Not seeing any skin lesions. I'm seeing a scar at the right above the suprapubic region, possibly a scar from a C-section.
That's correct.
It's a sectional scar. Okay, everything's normal there. She does not have any hair on her stomach. I'm looking at her umbilicus. Position is normal, color normal, and again, assessing the abdomen as a whole, symmetrical, no bulging. Okay, Miss Regis, I'm gonna go ahead and listen for your bowel sounds. Is that okay?
Yes.
Okay. With the diaphragm of my stethoscope, I'll begin auscultation at the right lower quadrant in different areas of the right lower quadrant. I'll be listening. Then I will move to the right upper quadrant. And then I'll move to the left upper quadrant. And then the left lower quadrant. Normal bowel sounds would be from 5 to 15 bowel sounds within a minute. Hyperactive bowel sounds would be that over 30 bowel sounds within a minute. And hypoactive would be less than 5 sounds in a minute. And if no bowel sounds were present, I would then again listen for a full 5 minutes. Okay, I'm gonna go ahead and begin with the percussion. I'm gonna listen for a bruit. Is that okay?
Yes, most definitely.
Okay. With the bell of my diaphragm, I'll be going over her aortic, renal, femoral, and umbilical arteries. Okay, I didn't notice any signs of a bruit. I didn't hear any bruits, any swishing or whooshing noises, so that's normal. And now I'll go ahead and begin with the percussion of her abdominal area. I'll start with the right upper quadrant. I'll move to the left upper quadrant, the left lower quadrant, and then the right lower quadrant. And if Leah had indicated that she had any problems regarding her kidney or urinary tract, I would then do I would percuss with my fist, and if there was any tenderness, we can move forward from there. Okay? And now I'll begin with the palpation of the abdomen. Is that okay? I'm gonna go ahead and touch your abdomen. All right, I'll begin with the right upper quadrant. Are you feeling any pain or tenderness?
No.
Okay, and I'm also checking for rebound tenderness. Now I'll move to the left upper quadrant. No tenderness?
No.
Left lower quadrant, just let me know if you feel any pain.
None.
And the right lower quadrant.
No.
Okay. And for palpation of organs or masses, that will usually be done by a practitioner, and that will also be a deep palpation for those. Okay. Now I'm gonna go ahead and palpate your liver. Is that okay?
Sure.
Okay. With my left hand, I'm gonna be going on her right side, on her back side, right underneath her rib cage, and with my right hand at the mid-clavicular line. During inhalation, I'll push forward. So breathe in for me. Breathe out. During exhalation. Okay, any tenderness?
No.
Okay, and now I'll go ahead and palpate her spleen. Putting my hand at the costovertebral angle. Okay, breathe in and out. Any pain or tenderness?
No.
Okay, all right, we're done.
We're done?
Mm-hmm.